Good day, everyone. I am Julian Garcia, together with my partner Kim Ivan De Leon. We are about to discuss other health impairment that listed in our nation's special education law. IDS definition of other health impairment. Other health impairment means having limited strength, vitality, or alertness, including a heightened alertness to environmental stimuli that result in limited alertness with respect to educational environment that is due to chronic or acute health problems such as asthma, attention deficit disorder, or attention deficit hyperactivity disorder, diabetes, epilepsy, a heart condition, hemophilia, lead poisoning, leukemia, nephritis, rheumatic fever, sickle cell anemia, and lastly, Tourette's syndrome, and adversely affects a child's educational performance. What's immediately clear from this definition is that there are quite few disabilities that fall under the umbrella of other health impairment, and those disabilities are very different from one another. That make it difficult to summarize other health impairment. The specific disabilities mentioned in IDEA's definition of other health impairment. First, we are discussing the common health impairment. Asthma is a chronic inflammatory disease of the airway that causes the following symptoms such as shortness of breath, coughing, tightness in the chest, and wheezing. Ang hika ay pangkaraniwang sakit sa baga. Ito ay maaaring mamana sa magulang at hindi ito nakakahawa. Ang treatment sa asthma ay inhalers and tablets.
And let's proceed to ADD and ADHD. When we say ADD and ADHD, ADD stands for Attention Deficit Disorder, while ADHD stands for Attention Deficit Hyperactivity Disorder. The only difference po sa dalawa is that ADHD has hyperactivity na ginagawa ang bata, kung saan from the word hyper, mas masigla sila. And yan po. And then sa symptoms po ng ADD and ADHD, they are experiencing hirap po sila sa pag-pay ng attention, kung saan hindi po sila makapag-concentrate. They are very active, masigla. Yan po yung tinatawag natin na hyperactivity na ginagawa ng mga taong merong ADD and ADHD. And meron po tayong tatlong type of ADD and ADHD. Una po dito is inattentive. When we say inattentive, dito mo po mararanasan yung madali ka ma-distract. Mostly po ng mga taong nakakaranas ng inactive type of ADHD is that female adults. And yun po, mararanasan nyo yung very overlook. Tingin mo sa sarili mo lagi, overlook ka. Then, very forgetfulness. Hindi ka, madali kang mawala ng alaala. Ayan, lagi kang nawawala ng mga gamit. And, yan, anxiety and depressions. While hyperactive naman po is mostly naman po nangyayari sa mga boys, men adult po. And dito nyo po ma-experience yung impulsivity, restlessness, short temper. In addition po, kapag nararanasan mo yung both symptoms ng inattentive and hyperactive type of ADD and ADHD, it means meron ka ng combined type. Yun yung pangatlong type ng ADD, kung saan na-experience mo lahat, so you have it combined. Combined po yung tawag doon. And some famous person na I can share na merong ADHD is that Michelle Rodriguez. She has been one of the most open famous people with ADHD by willingly sharing the story of her condition sa mga interviews na encounter na. She is very proud and loud. Not that loud, pero she is willing to interview kasi gusto niya na ma-encourage yung mga tao na merong ADHD na wag matakot gumalaw and just overcome it. And one fact about her is that he played one important role in a TV series and movies such as yung ano po, Lost and Fast Furious, yung mga kotse-kotse na mabilis. Isa po dun siya sa mga bida doon.
Third, diabetes. Diabetes is a disease in which the body does not produce or use insulin properly. Insulin is a hormone our bodies use to convert sugar, starches, and other food into the energy we need. Over time, having too much glucose in your blood can cause other health problems such as heart disease, nerve damage, eye problems, and kidney disease. Symptoms of diabetes include frequent urination, excessive thirst, extreme hunger, weight loss, fatigue, irritability, and blurry vision. There are two types of diabetes, and these are include type 1 and type 2 diabetes. Type 1 diabetes, it occurs where your immune system and the body system fighting infection attacks and destroy insulin, producing beta cells of the pancreas. It occurs quickly in the matter of weeks. The treatment used in type 1 diabetes is taking insulin through injection or by using. Ang type 1 diabetes ay nakadepende sa genetics. Ibig sabihin po ay maaari itong mamana. While type 2 diabetes, this is the most common form of diabetes caused by several factors including lifestyle factors and genes. The treatment used in type 2 diabetes is by taking tablets and insulin and by eating well and moving more. Ang type 2 diabetes po ay konektado sa pagkain natin ng matamis na pagkain. Pag mas marami tayong kinakain ng matamis na pagkain, malaki ang tsansa na mas mabilis tumaas ang sugar level natin. Ibig pong sabihin, kapag tayo po ay may type 2 diabetes, mas madali po tayong makaka-recover if mag-engage po tayo sa mga outside exercises like jogging, biking, cycling, and many more. Now, we will move forward to less common impairment. Ito po yung mga sakit na kasama sa other health impairment na madalang nating mapakinggan. Una pong kabilang dito ay ang epilepsy. Ano nga ba ang epilepsy? Epilepsy, a physical condition that occurs when there is a sudden brief change in how the brain works. When brain cells are not working properly, a person's consciousness, movement, or action may be altered for a short time. These physical changes are called epileptic seizure. Epilepsy affects people in all nations and of all races. Symptoms of epilepsy include blackouts or period of confused memory, episode staring or unexplained unresponsiveness, involuntary movement of arms and legs, fainting spells with incontinence or followed by excessive fatigue or odd sounds, distorted perception, and feeling of fear that cannot be explained. Sa mga napapanood natin, akala natin na lahat ng nagsisisure ay may epilepsy na, subalit hindi lahat ng taong nakakaranas ng seizure ay may epilepsy. Minsan, hindi natin alam na ang taong nakatingin lang sa kawalan ay inaatake na rin ng epilepsy. Ito ang tinatawag na staring spell na kasama kanina sa symptoms. Ang kondisyon na pwedeng magdulot ng brain damage at mauwi sa epilepsy ay brain tumor, brain infection, at matinding head injury sa ulo. Maaari rin magkaroon ng epilepsy pagtanda ang mga sanggol na kulang sa oxygen nung pinanganak. Treatment include in epilepsy is medicine called anti-epileptic drugs or AEDs, surgery to remove the small part of the brain that causing the seizure, a procedure that put a small electric device inside the body that can help control seizures, and a special diet called ketogenic diet that can also help control seizures. Second, less common impairment is a heart condition. Heart condition refers to any problem affecting the heart such as coronary artery disease, arrhythmia, and heart failure. Coronary artery disease, also known as most common disease, It develops when the arteries that supplies blood to the heart become clogged with plaque. This causes them to harden and narrow. Plaque contains cholesterol and other substances. As a result, the blood supply reduces and the heart receives less oxygen and fewer nutrients. In time, the heart muscle weakens and there is a risk of heart failure and arrhythmias. When plaque builds up in the arteries, it is called atherosclerosis. Plaque in the arteries can rupture from blockage and causes blood flow to stop, which can lead to heart attack. Treatment for coronary artery disease usually involves Treatment for coronary artery disease usually involves lifestyle changes such as not smoking, eating healthy, and exercising more, and some medication. Fourth, hemophilia. Hemophilia is a rare inherited disorder in which your blood doesn't clot properly. As a result, people with people with hemophilia may bleed after an injury for a longer time than those without the disorder. It's it's a myth that persons with hemophilia bleed to death from even minor injuries. In truth, the condition ranges mild to severe. Symptoms include excessive bleeding, excessive bruising, easy bleeding, nosebleeds, and abnormal menstrual bleeding. Bleeding can also be internal, especially in knees, ankles, and elbows. The best way to treat hemophilia is to replace the missing blood clotting factor so that the blood can clot properly. This is typically done by injecting treatment products called clotting factor concentrates into a person's vein. Next, lead poisoning. Lead poisoning is an illness caused by ingesting or inhaling lead. It is result anemia and damage to many organs including brain, kidneys, liver, and gastrointestinal system. Signs of lead poisoning are rather non-specific, sometimes making diagnosis more difficult. Symptoms include irritability, loss of appetite, weight loss, sluggishness, abdominal pain, vomiting, constipation, unusual fairness from anemia, and learning difficulties. First step in treating lead poisoning is to remove the source of the contamination. If you can remove lead from your environment, you might be able to reduce the likelihood that it will cause problem. For instance, sometimes it's better to seal in
Okay, let's proceed to leukemia. Or sakit sa dugo. Yan. Leukemia is a large number of abnormal white blood cells are produced in the bone marrow, kung saan mas lamang daw po ang white blood cell kaysa sa red blood cell, na dapat po ay red blood cell ang mas lamang sa ating katawan. And they can't perform their proper role of protecting the body against disease because of these symptoms. Slow healing of cuts and excess bleeding, and kapag nagkakasugat sila, mabagal yung pag-heal ng mga sugat nila. Like ng mga normal na walang sakit or walang leukemia na isang araw matutuyo agad yung sugat nila. Sa kanila, hindi. And, ayan, black and blue mark or bruises. Yan, mga pasa. Black and blue. At minsan mayroong red. Kasama siya dito. And, kahit walang reason, kahit hindi ka mapatama, mahiga ka lang. Symptoms yun kapag may nakita ka na pasa, madaming pasa, hindi lang isa. Kapag may nakita ka madaming pasa na kahit wala ka namang ginagawa, maybe that's the symptoms of leukemia. And ayan po, skin acne in bones or joints. And for example, ito po ay sa mga tuhod, sa balakang, sa baywang, sa shoulders. Yan po. And what I can say about the treatment is, ayan, kasi cancer siya. Cancer in the blood. So, mostly ng mga dapat nating gawin na treatment is, ayan, consult by doctors, chemotherapy, targeted therapy, radiation therapy, bone marrow transplant. Yung bone marrow transplant po is surgery kung saan papasahan ka ng bone marrow ng any positive or compatible donor po para sa'yo. Yan mga chemotherapy, targeted therapy, yan po yung mga therapy na ginagawa na consulted po ng mga doctor na gawin natin. Sa famous person na na-experience yung leukemia, na may leukemia, he is Evan Handler, who is best known as his role on Sex and the City and California and Californication has been very open about this journey with leukemia. Early in his profession career, Handler was diagnosed with AML at age of 24. At the age of 24 po, nalaman niya na agad na may leukemia siya. As you can see, yan po yung may mga cancer. Mostly meron silang nakakalbo. Kailangan nila magpakalbo kasi hindi na nakukuha ng nutrients ng kanilang mga buto. Po natin is nephritis. Any idea about nephritis? So, nephritis is or means that one or both of a person's kidneys are inflamed. When we say inflamed, lumalaki po siya. And the kidney is very important organ in the body because they clean the blood by filtering out excess water, salt, and waste. We all know kidney is one of the important organs of our body kasi ni-clean niya yung body natin into yung mga salt, yung mga kinakain natin, sugar, ni-clean po. Ni-filter ng kidney yung katawan natin. And nephritis may be due to infection but is more commonly associated with autoimmune disorder that affects the major organs of the body. Individuals with lupus or example are much higher risk for developing nephritis. Ayan, sinasabi po dito yung mga may sakit na lupus is more highly risk na magkaroon ng nephritis. And some symptoms of this is high levels protein in the blood or paradoxically low level swelling, while salt and water build up with the tissues, less frequent urination, and weight gain from water retention. And some treatment of this is, pagbabawas ng maalat, products from the food we eat. So, he is Griswold Chapman. Griswold Chapman is an actor in 30 Rock, if you know 30 Rock. He has a kidney failure due hypertension transplant recipient. Next po tayo is when we say rheumatic fever, can develop as a complication of untreated or poorly treated strep throat scarlet fever, although it's fairly common worldwide. Ang alam ko po to sa rheumatic fever, parang lumalaki yung puso mo or organs mo sa katawan. Such as, yun yung mga skin, pamamasa, bruises, paglaki ng puso and brain. Yan, mga joints, lumalaki siya. And some symptoms of this is fever pain in one joint that moves to another joint, red, hot, and swollen joints, small, painless nodules beneath the skin, rapid fluttering or pounding heartbeats, shortness of breath. Ayan, kapag nahirapan kayong huminga, maybe meron kayong rheumatic fever. And some famous person of treatment muna po tayo. Punta po tayo sa treatment. Ayan. Especially, po siya, consult your doctor first. Tapos, treatment po na pwedeng i-prescribe ng mga doctors is antibiotics, anti-inflammatory drugs. Ganun po. And a famous person na pwede po natin i-share about na mayroong rheumatic fever is Ashton Kutcher had vasculitis. Haba ng pangalan. He was 70 shows and MTV icon. Ashton Kutcher says that he is lucky to be alive after battling vasculitis as a serious autoimmune disease that impairs his hearing, vision, and walking ability. Ayan. Ang daming pwedeng magawa ng rheumatic fever sa atin. Ayan o, sabi niya dito, parang naranasan niya ma-impaired yung hearing ability niya, vision, and walking ability. Ako naman po tayo sa sickle cell anemia. When we say sickle cell anemia is that, di ba po mostly na mga blood cells natin is bilog. Bilog po siya. Yung mga ganyan lang kabilog. Pero, yung sa sickle cell anemia naman po, yung bilog na yun is turning C. Parang buwan lang siya. Minsan bilog na nagiging C, minsan half. Pero sa sickle cell anemia, yung bilog nagiging C lang siya. Yung blood cell na yun is nagiging C. And ayun. Kaya po siya nagiging C is because of abnormality of the hemoglobin. Ano po? This shape makes it hard for the red blood cell to pass through the small blood vessels, causing pain and damaging organ. Kasi nga, pasi siya, more curvy siya. So, madami siyang tusok-tusok na nagiging. So, hirap siya makapasok sa mga small or vessels natin. Anemia in general is a condition where an individual blood has less than normal number of red blood cells, or red blood cells themselves don't have enough hemoglobin. And some treatment of symptoms of this is yan po, episodes of pain, swelling of hands and feet, frequent infection, delayed growth, and puberty vision problems. Yan. And some treatment of this is blood and bone marrow transplant, tulad po ng kaninang sakit na that's leukemia. Kailangan po din, some treatment po ay kailangan din ng bone marrow transplant. Ako naman po tayo sa sickle cell anemia. When we say sickle cell anemia is that, di ba po mostly na mga blood cells natin is bilog. Bilog po siya. Yung mga ganyan lang kabilog. Pero, yung sa sickle cell anemia naman po, yung bilog na yun is turning C. Parang buwan lang siya. Minsan bilog na nagiging C, minsan half. Pero sa sickle cell anemia, yung bilog nagiging C lang siya. Yung blood cell na yun is nagiging C. And ayun. Kaya po siya nagiging C is because of abnormality of the hemoglobin. Ano po? This shape makes it hard for the red blood cell to pass through the small blood vessels, causing pain and damaging organ. Kasi nga, pasi siya, more curvy siya. So, madami siyang tusok-tusok na nagiging. So, hirap siya makapasok sa mga small or vessels natin. Anemia in general is a condition where an individual blood has less than normal number of red blood cells, or the red blood cells themselves don't have enough hemoglobin. Of this is yan po, episodes of pain, swelling of hands and feet, frequent infection, delayed growth, and puberty vision problems. Yan. And some treatment of this is blood and bone marrow transplant, tulad po ng kaninang sakit na na-discuss ko. Ano nga po yun? That's leukemia. Kailangan po din, some treatment po ay kailangan din ng bone marrow transplant. And ayun, yun lang po yung treatment niya for sickle cell anemia. Kailangan po ng bone marrow transplant. And a famous person po na pwede nating i-share na naka-experience ng sickle cell anemia is that John DeVos Watkins. The TLC member has sickle cell anemia and has served as the spokesperson for the Sickle Cell Disease Association for America. Yan, siya po yung spokesperson ng Sickle Cell Disease Association of America, kung saan siya po yung mga nagbibigay siguro ng mga symposiums about how can we prevent, help, and paano natin maiiwasan magkaroon ng sickle cell anemia? Si Timothy Boswatsky. Ayan, proceed naman po tayo sa Tourette syndromes. Alam naman po natin to, no, na discuss naman na po natin ang Tourette syndrome. It is a disorder characterized by tics, involuntary rapid sudden movements, or vocal outbursts that occur repeatedly. Yan, tulad po ni Brad sa pinanood natin na movie or documentation na pinanood po natin ni Doc Ken. Siya po is a person na naka-experience ng mga movement and parang pwede din sa pagsasalita na hindi natin mapipigilan. Sabi niya nga, he can't help it. Hindi na may iwasan kasi sakit niya yun. Meron siyang Tourette syndrome. And some symptoms of Tourette syndromes na meron kang Tourette syndromes is that the tics can change from simple rapid eye blinking, facial grimacing, shoulder struggling, to complex involving several muscle groups such as hopping, bending, or twisting. Vocalizations can also range from the simple throat clearing, sniffing, grunting, to complex involving words or phrases. Ayan. Treatment po natin sa kanya is, actually, sabi nga po nila, treatment po ang Tourette syndromes. Pero, as a human being, kailangan po nating irespeto na lang and accept yung mga taong may Tourette syndromes kasi parang in that way, parang naleles yung pressure sa kanila. Meron silang iba sa kanila na meron silang Tourette syndrome. Parang pressure sila na wag gawin yun. Pero nagagawa nila kasi they can't help it naman. Person na pwede nating i-share is Brad Cohen. He is an American motivational speaker, teacher like Brad, and school administrator and author who has several Tourette syndromes. Cohen described his experiences growing up with the condition in his 2005 book. And nakagawa pa siya ng book. Brad Cohen po ang pangalan niya. And that's all. Thank you so much.